how driven for connection with other people we are. So she was telling me that some of her friends are doing this thing, this is a teenage client, where they drive into a parking lot and all sit in their cars and like point their cars towards each other and talk on their phones to each other. And just like look at each other and talk at each other on their phones. And this is something that like, it makes me want to cry talking about it, but like, I can just imagine in the future thinking about like images of this kind of thing happening. And just thinking about like all the ways in which people kind of find solutions around different things. I have another client who was telling me that like one of her 16th birthday is going to come up and her mom is thinking about ways to like think about making this 16th birthday party special for her because she can't have a birthday party. And she's going to mail her friends little like cupcake making kits that they can each make at their house and then have a Zoom party where they make cupcakes together. And I mean, even though there's a lot of sadness and loss in each of these little stories about opportunities that are missed for connection, there's also so much beauty, I think, as well, in terms of how the lengths that people go to try to sustain the connections they have with other people. And of course, there are like hundreds and thousands of stories like this. So I've just been, I think this week, feeling grateful that we're motivated to stay connected to one another.
Thanks, Jessie.
Yeah.
That was inspiring. And I too have been inspired by my colleagues at UCI. We have been furiously planning to try and provide the best care we can for our patients under very different circumstances. So in many cases, this means helping them stay out of the hospital or the clinic. So we switched over to Zoom visits this week. And it wasn't entirely smooth, but it's gone a lot more quickly than we would have imagined. And I think I've been inspired by seeing all of my colleagues from anesthesia in the ICU to our residents in family medicine and the medical students all stepping up to say, what can we do? How can we help? How can we do the best job we can to prepare for what might be coming so that we can do the best care for our patients? So it's really been very inspiring for me to see how quickly and well people have adapted. It hasn't been easy. It's been very stressful, but people want to make a difference. They want to make a contribution, not just in the health system, but really in the neighborhood. I see that in our community as well. So it's inspiring.
Absolutely. So let's start, Jessie, with you and with the questions that we have. And I will then share these questions after we go through them later in a Google Doc. We'll save the chat and I will then send those to the people who are on the chat. So the first question is this is so present for me as well. How do I know whether my neighbors and friends are emotionally, mentally okay? What things can I or should I observe? What therapist skills, in quotes, can I use to check on people without saying, are you extra depressed?
Susan, is it okay if I share my screen?
Oh, absolutely.
Okay. So Susan gave me some of these questions ahead of time, so I just made a little visual aid to, oh, you know what? It says that the host disabled screen sharing. Do you know how to disable it?
Now you should be able.
Okay, cool.
Thanks, McKinley.
Let me, okay. Can you guys see my screen?
That's great, yes.
Okay, yeah.
Okay, so this is the question here. Okay. So this is the first part of the question. I kind of divided it into two parts of the question. So I think this is a great question. I think one of the things that makes this really hard is that we're really socially distanced from people, if we're doing this well. So we don't have a lot of information about how other people are doing. We might have a lot of information about how people in our direct families are doing, maybe too much information about how people in our families are doing, but not a lot of information about how other people in our community are doing. Okay, let me see, it's not going to next. Okay, let me see if there's a way for me to minimize this. Okay, there we go. So these are some things that I was thinking would be kind of signs of distress. And, you know, I'm trying to think about what you might be able to see in kind of passing interactions that you might have with neighbors, or in conversations that you're having over the phone or over Zoom with people, or in interactions with people at the grocery store, or things like that. The kind of classic signs that we see when we think about mental health problems, or signs of distress, or hostility, irritability, aggression, that's outside the norm. So someone, you know, yelling at somebody or behaving in a really aggressive way, a lot of fear or paranoia. And again, you have to kind of weigh this in terms of what's appropriate for the situation. It makes sense that people have a lot of concern, but I think something that seems really far outside the norm. So someone who is not leaving their house to get groceries, for example, or is not accepting any packages at all, won't allow things to come into their house. If you become aware of like someone who's engaging in rituals, behaviors that are taking hours and hours and hours before they let a package get into their house, that kind of thing that seems like it's really exceeding the norm of what you would expect. Social withdrawal that's, again, outside the norm of what people are recommending. So goes far beyond what people are saying is appropriate for social distancing. So someone who won't stand, 30 feet apart from someone would be like something that would be worrying. This is a sign that would be worrying in terms of depression-related risks. So someone who's showing signs of like hopelessness or loss of interest or pleasure in things that used to bring them pleasure. So someone who says something like, nothing is making me feel good anymore. I just don't have any motivation to engage in anything at all. I think probably substance misuse is something that is really risky right now because there's not a lot that people can do to bring them pleasure. But substances, especially for adults, are pretty readily available. So someone who's taking in a lot of substances, that's something else that I would watch for a lot. And then a failure to be doing what people need to be doing. And again, that's not accounted for by, for example, having to homeschool your children or something like that. Okay, and kids, the signs I think are pretty similar, except you have to think about them as in terms of what they would look like in terms of children based on their developmental stage. So kids who are fighting a lot with their siblings, maybe way more so than you would expect, given that they're all confined in the same space. Kids who are looking really irritable. Kids who are unable to sleep or having lots and lots of nightmares at night because they're so worried about coronavirus. Kids who are staying in their room all the time and don't want to come out or don't want to play with other kids. Teenagers who don't want to have any kind of contact with their peers are talking about not wanting to go back to school. I have a number of clients who are talking about that already, teenage clients who are anticipating not wanting to go back to school when it comes up again. Having, conflicts, a lot of conflicts with their siblings or peers. And again, the same loss of interest or pleasure. That one's a risk for depression, substance use, and then not completing their schoolwork. Okay, the second part of this question was what therapist skills can they use? And this, I would like to think of them as people skills or human skills, but yeah, therapist skills. So I think the first way to kind of approach this type of thing would be to normalize distress, because one of the risks if you're trying to say like, are you doing okay, is that you right off the bat, if someone is if there's stigma around feeling distressed or they're shaming themselves for not doing okay, you can kind of get rid of that right off the bat by saying something like, of course you're having a hard time. This is an incredibly hard time right now. Everybody's struggling. This situation is making all of us really struggle. We're all having a lot of distress. So making statements that are indicative that it is totally, totally expected that this is a hard time. The second thing I would do is express empathy for that distress. So state that you care about how that person is feeling. I'm really sorry that you're struggling. I wish this weren't so hard for you. The third thing that I would do is offer to help in really concrete ways. Saying something like, can I help? Or let me know if I can help is usually not helpful to people. It's really hard for people to ask for help, and it becomes much harder to ask for help when people are struggling. So it's a much, much smarter, better strategy to say, can I do this for you? Can I do this for you? Or can I do this for you? So to offer to help in 3 or more concrete ways. I wouldn't offer to help in 10 ways, but I would offer to help in maybe 3 ways. And if you give people 3 different options about how about if I do this for you, or how about if I do this for you, or how about if I do this for you, and then they can say yes or no to those options. And you have to think creatively about how you could help, because it's actually quite hard to be helpful right now, given all the restrictions that are in place. I listed kind of a few different ways right here, but depending on what you think might be hard for this person, or what might be helpful to them, you can try to think creatively about ways you could help. And then I think following up and following through with whatever you've offered is really important. Checking on if you were able to help for them, like, was what you did helpful in fact? And if it was, then try to repeat it. Or if what you did was not actually helpful, then try something different. What would be helpful for them? Okay, that was that question, Susan.
That was great. Well, you've got these here. How should I manage my child's time during this extended quarantine? How do I balance my child's needs for independence and structure? And how does this change with age overall?
Oh, this is such a hard question. I feel like the rest of the questions are all about parenting, and how to be a parent during this time is so hard, because the challenges of parenting have just, the whole parenting landscape has changed. Like this is being a parent right now is just a totally different, this is a game changer. So I'd say my recommendations for structure are generally, I think that it really helps to have a daily schedule for kids right now. I wouldn't say it helps to have a really rigid schedule, so not a schedule on the order of like this hour we're doing this, or these 10 minutes we're doing this, but roughly like this is the time we roughly wake up, and this is the time we have breakfast, in the morning we do this, and in the afternoon we do this, or kind of whatever works for your family, but having some kind of sense about this is kind of what our daily rhythm is like. I think that's actually really helpful for children, and it's probably helpful for you too. But in terms of what's going to help your kids, and in terms of what's going to create predictability for them, I think what kids are really lacking right now is predictability, routine, rhythm, and a sense of normalcy. And that's, I think, incredibly helpful for them. In terms of increasing their psychological sense of safety, which I would argue is probably sorely lacking for all of us, and especially for kids, structure is really important. I also think marking time for kids on a daily or weekly or monthly calendar can be really important, just so they know, like, this is the time that's been marching on, this is the day we're on. It's really easy for kids to lose track of like what day it is, since all the days feel the same. And so for them to know this is how much time we've passed through, just so they feel kind of a sense of accomplishment, that it's not that no time has passed. I think the degree of scheduling that you need to do for your kids should lower as your kids get older, and you can involve your kids, and probably should involve them as they get older. So junior high school kids and high schoolers should help make up their own schedule for what the day should be like. What should, you could ask them, what do you think your schedule should be like? What would be a helpful schedule for you to maintain? One thing I would really recommend is trying as much as possible to help keep your kids' sleep cycle on track. I've noticed that a lot of teenagers in particular are really off in their sleep cycles, so that meaning that they're going to bed really late and waking up really late. And that's what happens to teenagers during the summer as well. And that's just not, it's not super ideal. I think getting a little bit off in terms of sleep, like going to bed a little bit later, in terms of, when I say a little bit, like an hour or two later, and waking up an hour or two later is not the worst thing, but getting super off is not great for them. I think building in exercise to their schedule is really good, especially since, you know, they're getting less out and about time, and you can build in new kind of elements to your schedule. I'm sure a lot of families are already doing this. So like family exercise is great. One of the elements of this schedule was, or this question was, how do you balance a child's need for independence? I think that, and this is also, you know, based on the child developmental level, but I think one idea would be that the parent, if your kid's younger, the parent could make the schedule or decide this is what the schedule should be, but you could build in flexibility into the schedule. So the parent decides this is your reading time or this is your academic time, but then the child gets to choose within that. So that, you know, parent decides this is the reading time, but the child chooses the book, for example. Okay, this is the next question, Susan.
The public schools want my children to do everything online, improve their time working. How do I balance these demands with the almost universal advice to limit screen time? That's a great question.
Yeah, this is a great question. And I feel like in answering this question, I wanted to take this approach of just completely stepping back for a second. And I hope that's okay with whoever asked this question, because I think that when I kind of saw this question, I was just thinking again about how much of a parenting challenge this whole situation poses, and how I think that it's almost impossible to just answer this question as it is. And I think that's the way for so many questions about parenting right now. So I wanted to step back a bit. I feel like this is really a time like really we've never really experienced before. So I think that almost it's important to think about, okay, what are your parenting values and goals during this time? And then how do you wish to go about accomplishing those goals? Because, and this is kind of what I would recommend anyway, as a parent, that you have parenting values and goals, and you think about how do you want to achieve those parenting values and goals. But right now it has to be different because we're so limited. We're not operating with the rules are not the same right now. And we've got to kind of, change course. So I think we have to just kind of be ready to do that. And I think that the normal rules that we might have around technology or time outside or bedtime or limit setting or any of these things that we normally have rules about, I think we have to be prepared to be flexible around those. So I thought I would do this task myself for you guys, since I don't know any of you, and I didn't know who asked the question. So I thought I would just give you an example about, and everyone's parenting values would be different, right? If I asked you to do this, everyone's would be different, and everyone's way of implementing this would be different. But just to kind of think through this together, if I were to say, okay, what are my parenting values during this time? It would look something like this. My values as a parent would be, okay, I want to keep my children, my family, and my community physically safe and healthy. That's probably my number. These are probably ordered in terms of priority. Number 2 would be, I want to keep my children feeling psychologically safe and in good spirits. And then I want to help them continue to thrive in various different ways. That one for me is less important than the other ones. But it may not be less important for different people, but for me right now, that's less important. So then I think about, now, how do I want to kind of implement these things given all of the different constraints? So the first one, in terms of keeping my kids healthy, I'd be implementing that by social distancing and hand washing. My husband is a first responder, so he's still working out in the field. He's a police officer, so we have a little bit higher risk, and so we've got to do a bunch of extra things. And so I've got to protect my kids in certain different ways, right? But like, we're trying to keep things controlled in certain ways, okay? Number 2, there's not much to do there because, we're just keeping things controlled. Number 2, this one's a little bit more complicated. Keep my children feeling psychologically safe, low anxiety, and in good spirits. Okay, how do I try to implement that? One, structuring home time, because I think that actually contributes to their sense of safety. I think that having, again, like I said before, I think keeping things really structured makes them feel really safe. I think it makes them feel like, okay, this is a new kind of normal. This is a new routine. They're settling into it. It's like, this is what we do during this time. Exercising because it reduces their stress. Limiting their exposure to news because this might create anxiety. Talking about it when I'm feeling stressed, because I think that when they sense that I'm stressed and I'm not talking about it, which I am stressed, I mean, this is a stressful time, I think that's actually far worse than them just like feeling I'm stressed and me not talking about it. Telling them the truth about what's happening in the world when they ask questions, like, when are we going to go back to school? Or why are people so scared? Or, who do I know that's sick or whatever? Although giving them like a kid sanitized version of the truth and only telling them when they ask, or when I think it's really important that they know something. So if I think they're going to engage in a behavior that's not safe, for instance, because that goes back to value number one, right? If one of my kids, and when my kids did do this, they were not like obeying the rules of social distancing, they were getting too close to someone else, and then I had to tell them, this is why you need to do this, because it's not safe. But that rule kind of butts into rule number two, because I don't want to raise their anxiety, so I have to do it in a way that's kind of delicate. Okay, so that helps them trust me and feel safe with me. And then I'm spending a lot of time thinking of fun things we can do together so that we can try to make this time feel different and maybe feel fun in different ways. Okay, value number three is then helping my children try to kind of do new things and grow and still develop in certain ways that are important for them in other ways, while also trying not to be so perfectionistic. So yeah, that means doing the homeschooling. It means a lot of like education online. It means Zoom meetings. It means trying to work with my internet to make it feel better. It means trying to have play dates online. And it means not getting to every requirement a teacher sets. That's for me, right? Now, I just did that, walked you through that just so you could have kind of an example of like, how would you do this? But I want to go back to the question that was asked. So how do we do this with screen time? Well, my question back to you would be, how does this fit with your parenting values? And then I would also say that typically the reason why people say screen time is bad is because of what kids do on screens. Because mostly what kids do with screens is they passively receive information. They sit there, they numb out, they take things in, but they're not engaging in any kind of intelligent way. And that's actually not what like they're doing when they're in school. The stuff that happens over school usually is pretty active, it's pretty involved, typically. I don't know because I'm not watching your kids, so I'm not sure what they're doing, but I would guess that it's not passive receiving of information. On the other hand, maybe this kind of violates your parenting value. Maybe that parenting value is really important to you right now, and I'm not sure how that fits with your parenting value. I think it's okay to set your own parenting priorities, and it's okay to set rules for this time of life that might be different than what happens at a different time in life. But I also think it's okay to say no to school things that don't fit with your parenting values. I think it's okay to do education your own way right now if you don't want to do it that way. So I don't know if that's an answer that helps or not, but that would be my answer to you. Okay.
I think that was hugely helpful, and I've heard that question asked in a variety of different ways. So having walked us all through that, I think that's a beautiful framework. I appreciate that. How do I impose discipline while recognizing that so much has already been taken away from my children? I don't want to be overly permissive, but I don't want my children to feel like they live with a tyrant, me.
Yeah, so this is also a great question. I want to know who all these people are because I like them a lot already. This is a really good question because I think that this parent, whoever asked this question, really cares about their children and feels really empathizes a lot with what their kids are going through and is taking on a lot of responsibility for the loss of what their kids are feeling. And that makes me really like that person. My answer to that question would be the following. And that would be like, I think I kind of go back to the answer from before, which is that I do think having priorities in terms of having like, I think that kind of going through this mental exercise of coming up with a parenting value kind of framework would be helpful, just even mentally to think about. And I would do this if you have a co-parent, a partner who co-parents with you. I would do this with your co-parent so that you're on the same page about this. But I think that having some grounding principles that you have about what are our most important goals for our kids right now, what are our most important values is really important, because it may not be that they're the same values that operate during everyday life, but some of them will probably be the same. So, and I still think discipline is really important, regardless of what other things your kids have lost and regardless of what else your kids are going through. And I also think it's actually really important psychologically for your kids. So even though your kids have lost a lot, and maybe actually because your kids have lost a lot, it's a really important part about life being predictable for kids. So limits make kids feel really safe. It makes them feel that their world is predictable. It makes them feel that their parents are in charge of things. And that's part of kids feeling like the world is an orderly, safe place where things make sense. And that's what they need to feel right now, actually. Because a lot of things don't make sense right now. A lot of rules have changed in their lives, and that creates a lot of anxiety in kids. And so actually a lot of what you could do for your kids is have very consistent rules and limits about certain things that are not okay. For example, being unkind to your siblings is probably still not okay. Hitting your siblings, for example, is not okay. Taking things from your siblings is not okay. That kind of thing. I think that discipline for those kinds of behaviors would be not only okay to do as a parent, it would be recommended to do as a parent. So I think it's actually my message would be that it's scarier and worse for kids if parents can't or won't set limits for them.
Great. Thank you so much.
Yeah.
Am I muted? No. That's wonderful. I think that provided a tremendous framework. And I'll just take a minute to say what I didn't say in the beginning, and that is we are recording these, and they are available on our YouTube channel. So all the parents who are busy right now with kids may want to check in later. Yeah. So we'll have that for you. Cindy, I still have a lot of questions for you on the nature of the virus, as well as medical treatment and immune response. So if you are okay, I will slug on ahead.
Sure, but let me just first say that I so much appreciate hearing from Jessie, because we've recognized that in addition to the actual pandemic of the virus, which is a physical disease, illness, there's also a mental component to it, the psychological impact. And so I feel that paying attention to our mental health as well as our physical health, they have to go hand in hand. So thank you so much for that. It was really helpful. And I know that especially for parents with school age or younger children, it's a very confusing time. So that was great advice. It's terrific. Thank you.
Thanks, Cindy. Yeah, you're welcome.
Yeah. Absolutely agreed. Thank you. So the nature of the virus. Here's the first question, and I think this comes from a lot of discussion on the listserv and probably across the country. My question is about masks. Are homemade masks a good idea for the neighborhood?
So first of all, let me thank you. There's so many people that are making masks, that are donating masks to UCI. It makes a difference. So we have come to understand a little bit more about the transmission of the virus over the last few weeks. It is primarily transmitted by respiratory droplets, but we know that droplets can sometimes become aerosolized. That is, the droplet, instead of just being a drop that goes down, it can be suspended in the air for some period of time before it drops down. So that's called aerosolization. And there are certain types of procedures or certain things that can cause a droplet to go from being a droplet to kind of suspended in the air. And it's that idea of aerosolization or suspension in the air, particularly by people who may not be symptomatic. And so the good news about the virus is that 80% of the people who get it have either no symptoms or mild symptoms. So that's really good news. Most people who get it will get better. And some people will get it and they don't even really know they have it because their symptoms are so mild. And this is in particular for children. We're really thrilled that children do not seem to be as adversely affected by this virus. There have been some very serious outcomes in children, but by and large, those are very rare and few and far in between. And so children in particular are not as symptomatic, yet people who are not symptomatic could still be transmitting the virus. And just while I'm speaking, for instance, oftentimes you see when people are speaking, little droplets come out of our mouth because we have moisture in our mouth. We're having to exhale and we're to form words. And so there's a little bit of spray that comes out of our mouth just in the process of speaking to one another, right? And so if someone is speaking to you and they happen to have it and they're asymptomatic, they could be transmitting it to you without knowing about it, right? That's what the whole point of social distancing is about. Where do masks come in? Well, we know that by wearing a mask, particularly if it's sealed around the nose and mouth, there's less likely to be that transmission of droplets, right? So wearing a mask is more likely to protect other people from you than to protect you from other people. Because invariably, most of the masks that are being made that are not medical grade, tightly sealed masks, there still can be the chance of some air entering from the sides, from the top, and so forth. So it's not 100% sealed. And so you've heard probably about the N95 masks. Those masks are fitted, they're tightly sealed. There's really no, they're very small microns, so they filter out most of the particles, and there's no chance for things to come around. Those are the medical masks. The masks that people are sewing, or bandanas or scarves or anything like this, it's going to reduce the transmission. There you go. There's a good example I see right there. So it will reduce the transmission out to others, right? But there's still a chance that droplets can come in. So there's been a shift in thinking about masks, a recommendation that people out in public wear masks. Simple masks or a bandana or something that will just basically reduce the volume of the spray of respiratory droplets. It's not 100% protective. We still need social distancing. We still need hand washing. I can't tell you how many hours I've spent in meetings about masks at the medical center, but the bottom line is we are now kind of seeing a shift in the recommendation of wearing masks in public, again, as another means of reducing transmission. But it doesn't mean that we should relax on the other pieces of hand washing and social physical distancing. Okay.
That's helpful. Thank you. That is very, very helpful. Has it been demonstrated yet that ill people who recover do in fact develop antibodies? And the sicker you are, the more antibodies you produce.
So this is a great question. What happens in terms of our immune response? And generally, people who are infected with a virus will develop their own immune response in the form of an antibody. And the antibody is something that our body produces to attack an antigen, something foreign coming into our body. So if we develop antibodies, we can attack those invaders, right? Because the coronavirus is new, none of us had those antibodies. That's part of why it's so dangerous, because it's a new virus that attaches to our respiratory cells and begins to do its damage, and we don't have any defense against it. Now, there's a big question at this point. We don't really know. We're still trying to understand, what does it mean for people who've been infected and develop antibodies? Can they get infected again? Are they always immune? How long does that immunity last? It's a very important question, because people who develop immunity to this virus will then be extremely valuable in terms of being able to be involved in the workforce and not likely to get it themselves, and perhaps not likely to transmit it to others, right? So we don't know. This is part of the challenge, is there's a lot of questions about this virus and our immune response that we don't know. We're just beginning to develop the testing of the antibody. And I predict that in the next 1 to 2 weeks, the antibody blood test will be available here in Orange County. It's not commercially available yet, but it's being very rapidly deployed. We still don't know what an antibody means, what a titer, what the levels of the titer, how long they will last. All of that is under intense investigation right now.
We actually, this is Eric. We actually in our at the university are developing these assays. Phil Feldner, who's the director of the Center for the Vaccine Research and Development Center, he has an assay that's there. We were just looking at his data yesterday, and absolutely beautiful. All of us will respond to proteins from influenza, for example, but nobody responds to this. And then Phil got serum samples from Washington State after their outbreak, or from their outbreak, and these people react absolutely beautiful. So Phil has not only got this test, but he can identify which proteins in the virus itself are actually being recognized, and that moves some way towards development of a vaccine in this as well. So Phil was on CBS LA, and he's on Fox LA this evening, I think. So you can see what he's actually doing.
That's great. That's very exciting. Well, it's so fabulous to know that many scientists, and Eric, thank you for speaking up. You and your colleagues are really on the cutting edge of trying to answer some of these very important questions.
Right.
So the next question is: the surface of COVID-19 positively or negatively charged? Can it adhere preferentially to change surfaces like hair? In other words, should we be washing our hair more often?
Eric, do you want to take that one?
Oh, I have no idea.
I don't
I'm not a
either.
virologist, and I've been looking at a few papers over the last week, but I have not noticed whether they're positive or negative. And the way we're thinking of these things is more the virus itself doesn't use positive or negative charge to get into a cell. It uses a specific receptor that's from one of these proteins, the so-called spike protein that binds. I don't know. These are enveloped viruses. So on the one hand, this is why you can get rid of them with detergent by washing your hands. That will kill them. On the other hand, if they're on an inanimate table or other object surface, how long they will survive, I really don't know. And I'm getting my information the same place everyone else is with regards to that. Cindy, do you have more information on that?
Well, not really. I think that we are still learning about how long does the virus last on various surfaces. of course, it's condition dependent, temperature, humidity, et cetera, et cetera. The other issue that I think is important is that the idea of a viral load, like what kind of a dose do you get? If you get, a very tiny dose, are you going to actually develop an infection, an immune response, versus getting a very big dose, inoculation, exposure? And so, again, we feel that most of the transmission is happening through respiratory droplets landing on the hand and then being transmitted to the nose or the mucosa that's entering our body. That seems to be the most of the transmission. We still worry about what we call fomites, that those are inanimate objects where some droplets could sit for a period of time, and then someone touches it and then touches their nose and mouth and gets it. So again, best practice is hand washing and not touching your face. Think about the T-zone, your eyes, nose, and mouth. You don't want to touch your face when you're out in public, right? Until you've washed your hands. So I carry hand sanitizer wherever I go. If I ever touch a doorknob or something that I think could be contaminated, I immediately gel down so that I don't accidentally rub my eye or something after I've touched a doorknob.
So let me just add something to what you said about the inoculum. In other words, the number of viral particles that you inhale. That is huge, and we all know, those of us who work with infectious diseases and animal models, that the dose is absolutely critical as to what level of infection you have. In fact, there was a really nice op-ed piece in today's New York Times that talked about this, that why are younger people getting infected? Well, they have a higher dose. Why are people in the hospitals getting more, healthcare workers getting more serious disease? Why? Because they're exposed to higher doses of the virus itself.
Mm-hmm.
Thank you. That is important. Can you seem to recover completely and then relapse? I think you addressed that indirectly before, but I'll ask you again. Do we know?
Right. I mean, typically, we haven't seen many people. There have been very few cases reported where someone had the infection confirmed, recovered, and then got it again. Very few cases of that. And then the question becomes, did they actually recover, or they never really recovered and they just had a relapse? They improved and then it got worse. So for the most part, it seems that people who get the virus and recover are not getting it again. Again, we're not sure how long the immunity will last and whether that it is possible to get reinfected. That's another question that's outstanding.
Well, it seems, at least from an immunological standpoint and from a virology standpoint, this particular virus is not mutating a whole lot. Therefore, if you've been exposed and infected, you're going to develop the antibodies you were talking about that can neutralize the virus particles. And if the virus is not changing or altering in any way, then the likelihood of being reinfected with the same virus seems to be somewhat unlikely. With flu, where we get it every year, is because the flu virus mutates so much. So we need a new vaccine each time.
Mm-hmm.
I have a very...
Do you have an explanation why this virus doesn't mutate as much as other coronaviruses?
I don't. And I don't think it's been studied long enough to even know if that is true. But from what they've been reporting, or at least what I've read, is they haven't seen signs of mutations in the virus. Do you know something different?
No. Okay.
No.
This is a very specific medical question. I sustained a fracture to my sternum from a motor vehicle accident just prior to this pandemic, and I am still recovering. This puts me at greater risk for developing pneumonia. How might this also influence my risk related to the virus?
So Yeah, well, I'm glad you're recovering. First of all, ouch, that hurts. Um, so when you have any kind of injury to the chest that causes it to hurt, to take a deep breath, then we know you're not expanding your lungs fully. And if you're not expanding your lungs fully, then there's more likelihood of kind of consolidation of parts of the lungs and pneumonia to develop. That's why we tell people who might have a broken rib, remember to take deep breaths, you know, or after surgery, take deep breaths, because we want to expand the lungs fully so that they can oxygenate and aerate. So any kind of lung damage that makes a person more susceptible to pneumonia, um, if they were to get the coronavirus, they may be at higher risk, right? And so that's where we come back to the basics of it's so important to take deep breaths, to eat properly, exercise as much as possible, get a good night's sleep. You want to do all those things that will help boost your immune system. Being in loving relationships, feeling connected to other people, having people that encourage you, and so forth. That boosts your psychological well-being, but we also know that your psychological well-being affects your immune system and its ability to fight off infection. And so, regardless of your circumstance, doing those basic things to keep yourself healthy will enable your immune system to work better, so that hopefully if you do get the infection, it won't be so severe.
That's great, Cindy. Thank you. Is it accurate to assume that we need to continue social distancing practices until a virus is developed?
Vaccine.
A vaccine.
Vaccine, sorry. Sorry.
Yeah.
No more
Well, right. There was a great article in the Atlantic about how the pandemic will end. I would recommend it. It's really well written. But basically, because this is a new virus, the way we're going to get through it is either we will develop herd immunity, that is, the majority of the population, more than 50%, probably 70%, will get the infection and become immune to it, or we'll get a vaccine, or we'll get effective treatment, or some combination of all of those, right? That's what will enable us to move through this. So that concept of herd immunity, you have to have enough people who've been exposed and infected and develop their own antibodies to fight it off so that they don't keep getting it back again, right? Or passing it on to others. And so how long is this going to last? I wish I could tell you. I wish I knew. We think that it's probably going to be many months before we get over this peak of the majority of people having been exposed. And what we've been trying to do is flatten the curve, that is, reduce the height of that peak so that it doesn't overwhelm the healthcare system, so that those people who do get seriously ill can get the care that they need. And so all of the social distancing work that we're doing that's turned our lives upside down, it's so important because it's saving people's lives. It's saving probably hundreds of thousands of people's lives in the long run. And looking at the curves for California, we're actually not increasing quite as fast as I'm sure we would have if we hadn't enacted the social or physical distancing. How long will this last? In some ways, the better we social distance, the longer it will last, because less of us will be getting the infection and it will stretch things out, right? But we won't have that same peak of the curve. And that peak going over the capacity of the healthcare system is where so many people would die. And that's what we're trying to prevent.
I would just add that there are lessons from past outbreaks and epidemics, such as the original SARS virus, SARS-1, and also from, more recently from the Zika virus outbreak in 2015, where this was a huge thing. We thought it was going to become a pandemic, but in fact, over time, the worries disappeared and people developed immunity, and so there wasn't further infection. So I think there is really cause for hope in the scenario that you laid out.
Thank you. Thank you. There are some California-specific questions, and I will save those until a little bit later. And I think we are getting close to our hour now. So I'm going to ask, is it okay to go over a little bit? I think we have enough questions that we will be going over.
Yeah, we could go over a little bit, and then I think we should all get a good night's sleep.
Absolutely, absolutely. So this speaks to treatment. Are there non-standard treatments the UCI physicians would consider for those who are very ill, such as the plasma from those who have been cured by the virus, of the virus?
So UCI is one of the sites that is actually conducting one of the trials regarding the antiviral drugs to see if they will be effective. So far, the feedback has been pretty limited, so we need to conduct those trials to gather the evidence to see if the treatment actually works or not. And so this is part of the science of medicine, is we need to apply those principles to the trials. So some trials are going on for antivirals for patients who are infected and admitted to our hospital. There are also some reports of using the serum of patients who've recovered from COVID, that serum could be injected into patients who are infected to perhaps confer some improved immunity or reduce the severity of the disease. Again, we don't have enough information to really say if that's effective or not. We want to be very careful that we go through the trials to collect the evidence. So we don't want to subject people to treatments that are ineffective or perhaps could even be harmful, unless we know that there's evidence that it makes a difference for the benefit of the patient.
Thank you.
Eric, I don't know if you would like to add to that.
Well, the principle of giving serum that contains antibodies, serum from people who've recovered, I mean, that's been around since the 1700s, since Jenner originally came up with these ideas and noted that the people who worked at the milkmaids were in the 1700s who were working with cows were resistant to smallpox, and so he took that serum and tried it, and it did work. And it's become more sophisticated over the last couple of hundred years, but the principle still is there.
Thank you.
So yes, people are trying this, and I think there's cause for hope that this can help the severity of the disease by just directly neutralizing the virus.
Thank you. Thank you. Thank you, Cindy. I'd like to ask Dr. Hawk's opinion, her own practice, as to whether dilute bleach solutions used on doorknobs should be rinsed in some way.
I'm a big fan of bleach. I've used it through my whole career because I've spent a lot of time in the developing world and where there were a lot of potential contagions. So I like to use a dilute bleach solution to wipe down surfaces. I do this pretty methodically. I don't believe that the bleach needs to be wiped down or removed afterwards. I think it tends to evaporate, and as long as, unless you're really taking in huge amounts of the bleach, it's not really going to hurt you, as far as I know. So I don't think once you wipe something down with a bleach solution, you need to keep rinsing it off. Not that I'm aware of.
Thank you. Thank you. One more medical question, and then two more related to California or specific to California. If I think I have the virus and I'm getting sick, when should I go to the hospital?
Wow. Yes. What a good question. And, I'm not sure that I can tell you 100% accuracy, but I will say that we know a lot of people get the infection and they have mild symptoms. It's like a bad cold or the flu, and they recover completely on their own. And because we have no effective treatment, we would not recommend for those people who have mild symptoms to go to the clinic or hospital at this point, because number one, you're exposing other people perhaps to the virus. You're exposing yourself perhaps to other people who may be infected. And number three, we don't have any effective treatment for it anyway, right? And so what we talk about, and we talked last week about supportive care, um, if you have symptoms of respiratory distress, that is, you feel short of breath, you can't catch your breath, you're breathing fast, you're feeling dizzy, like you could pass out, those are signs for sure that you need to go to the hospital. So respiratory distress, you cannot catch your breath, air hunger, that could be a sign that your lungs are having this reaction that the COVID can cause. It's called acute respiratory distress syndrome, ARDS, and it causes the lungs to basically not be able to oxygenate the blood properly. And if your blood oxygen level goes down, you feel weak, you can feel confused, you feel a sense of air hunger, you're kind of gasping for breath. Those are signs you need to be seen. You need to go to the hospital. You may need oxygen. You may need to be on a ventilator, right? So for sure, those are the signs. Also, for some people with COVID, they have a lot of, they can have GI symptoms, vomiting and or diarrhea. So if you're getting dehydrated to the point where you feel dizzy standing up, you can't keep fluids down, that would be another sign to go in. So those would be the more serious kinds of problems. Again, call your doctor, call your nurse. There are triage lines. Virtually every health system now has implemented triage systems and activated telehealth, telephone calls. So you can call and say, I'm not sure, I'm not feeling well, should I come in? And please don't hesitate to make that call and go in if you feel that you're not able to breathe properly.
It's great. I feel like we should all just take a breath after that. Nice, deep breath. So the last two questions, as I said, are California specific. How come California, the most populous state, is lagging in testing in 11 other states? Well, I cut that out of the article, but the question referenced a Politico site. So do you know that? Do we know that?
So why is California lagging behind? I think that the entire country really, in my opinion, is lagging behind. It's not just California. We really, we dropped the ball on the opportunity for early testing. I hope that we'll be able to catch up soon in terms of implementing more widespread testing. But some of the very basic things of dealing with any outbreak are a confirmation of the infection, prevention of transmission, and so the fact that we don't have swabs or medium for testing, it's, in my opinion, this is a failure of the U.S. healthcare system, and really a profit-driven healthcare system that has not invested properly in the public health infrastructure to keep all of us safe and secure in the event of a problem like this. And so now we're paying the price because we have cut public health funding, we've cut opportunities for investing in testing. And I mean, I can't believe that, something as simple as a mask, which is just made out of paper, basically, we can't produce that for our health workers. To me, shame on us, shame on the US healthcare system that we haven't invested in ensuring the safety and health of everyone.
Definitely second that.
So our last question, health experts keep talking about the great job that California has done. It is likely California, is it likely California successfully navigated the outbreak such that the virus has died out in much of the population? Or are we still bracing for impact of a much larger wave of infection on the West Coast? If so, where is that wave going to come from? Is the virus still lurking dormant inside some of us? The late stage of social distancing, at this late stage of social distancing.
Right. Well, so at this point, the Orange County Healthcare Agency, which is the public health agency in Orange County, we've diagnosed, they're reporting about 800 cases in Orange County so far. My guess is that that report of 800 cases is woefully underreporting the actual number of cases that are here in the county. But because testing has been so limited, we haven't been able to confirm these infections. And so as we ramp up our testing capability, we're going to continue to see the numbers of people with infection continuing to go up. At the same time, California enacted physical distancing and stay-at-home orders earlier than many other states. And we believe that those changes in our behavior, all of our behavior, are actually making a difference in terms of lowering that curve. So we hope that we can continue to see less of a steep rise in an increase over the coming weeks, but we will continue to see an increase. And that increase will probably continue at least for the next month, perhaps longer than that. We don't know for sure, but part of that depends on our behavior, how we behave, and how we keep away from each other so that we're not transmitting the infection. I will say I'm watching some of the chat messages, and the trials in Germany of sending doctors to the patients. Actually, we're working on some plans now to provide increased opportunity for home-based care for people who are not severely ill, that don't need to be in the hospital, or maybe can get out of the hospital earlier, even on oxygen, with home-based care, nursing, as well as telehealth. So we're getting ready to roll out some of those trials, and I'm very excited that I think we're going to be really able to provide care that patients need, that will help them overcome this disease, or identify those who need to be in the hospital and on ventilators, and we'll be able to take care of them.
And again, a breath. Thank you so much, both of you,
Yes.
for this information. This is incredibly helpful. And I know our community is grateful. We're all grateful for your support and your encouragement and your knowledge and your wisdom. Thank you. Hobart, do you want to take us out?
Sure. Hi, everybody. I want to thank everyone who's participated, and particularly Dr. Hawk and Jesse. This has been really, really a wonderful, wonderful event. And we want to continue these, of course. Right now, we're scheduled for Saturday, and I hope that this still continues to work for everyone. Please let us know at hrb@uhills.org if there are other times that would work for you as well. This is going to be on YouTube. We have a YouTube channel that has recordings of the other two meetings that we've had and this one. So you can also check that out. And information is at uhills.org at our website. And there's a particular page called Caring for Our Community in the Age of COVID-19. So check that out as well. We're going to be having a listing of Zoom meetings soon on uHills.org, where we used to have like our events calendar. It will now be a Zoom events calendar. So as people submit events that will be Zoom meetings, they'll provide their email information so that you can go ahead and register for those meetings. Thank you everyone again for participating. And Susan, do you have anything else as well?
I am just very grateful for you. Thank you so much. Thank everyone for participating.
All right.
Safe, everyone. Keep healthy.
Thanks, Cindy.
Thanks.
Okay.
Bye-bye.
Good night.
Thanks, Jesse.
Get a good night's sleep.